看见中国，连接世界。这里是澳洲中华电视中国故事节目。来自中美两国的青年医疗专业人士齐聚上海瑞金医院，参加中美青年健康对话。对话聚焦人工智能在医疗领域的应用，并表达了在医疗科技领域深化合作的愿景。
Artificial intelligence is the reality of today's medical field. From smartwatches tracking vitals in real time, to AI-assisted pathological diagnosis, and even digital.
AI can be incredibly helpful for example, early warning detection systems, alerting emergency medicine physicians to patients that may have sepsis. Similarly, AI can be incredibly helpful in reducing the burden of documentation for providers that are managing critically ill patients, and helping us to synthesize from the patient chart the clinical decisions that have been made.
Basically, AI is the calculation from lots of data, and with that we can decrease our error during our surgical life. For example, using this calculation, we can predict the potential complication after this kind of procedure. Then I can choose another one. So I think this is something very helpful.
The role of human intuition becomes even more precious.
Radiology, of course, and also pathology, digital imaging pathology. So in those two fields, and every field that is mostly about interpreting images, I think AI is at least superior than the average doctor. But in other fields, actually in my field, it doesn't really help yet, which is the field of guiding clinical decision-making in surgical oncology. AI is a great tool, but has to be led by the physicians. At this stage, AI does not have the clinical intuition or the creativity that is needed to lead clinical decision-making.
One of my fundamental roles in the ICU dealing with patients and families is to translate complex medical topics into a patient-specific context that takes into account not just their medical condition, but their values and their family's values. So I think that, a physician will always be interpreting these data and applying it to the particular patient. That's a fundamental role of a physician that I think cannot necessarily be taken away by machine learning or AI.
The tools are evolving, but the spirit of cooperation remains the constant. The dialogue revealed a powerful synergy.
I'm really impressed by the blend of tradition and high tech in China. On the other hand, US has a long tradition in biomedical research, so I think there could be a blend of sharing data, of sharing ideas, sharing infrastructures to advance precision medicine for both Chinese and US people.